This program will provide instructions on how to perform qualitative fit testing for half-face piece respirators, such as 3M Healthcare N95 particulate respirator and surgical masks, models 1860, also available as 1860 in a small size, as well as the versatile 3-panel flat-fold 1870. Please note that the instructions for the 1860 3M respirator and surgical mask being fit tested are the same for the 1870 3M N95 respirator and surgical mask. The 3M qualitative fit test training meets OSHA qualitative fit testing requirements. To prepare for this qualitative fit test, attach the hood to the collar by placing the drawstring between the flanges on the collar. Tighten the drawstrings and tie it with a square knot or a bow. Next, pour approximately 1 teaspoonful of the sensitivity test solution in bottle number 1 into nebulizer number 1. Pour the same amount of fit test solution from bottle number 2 into nebulizer number 2. A sensitivity test is conducted before the fit test to determine that the healthcare worker being tested can detect the test aerosol at very low levels. The subject must avoid eating, smoking, drinking, or chewing gum for at least 15 minutes before the test. To conduct the sensitivity test, first instruct the test subject to place the hood and collar assembly over their head without a respirator. Position the hood assembly forward so there is about 6 inches between the subject's face and the hood window. Instruct the test subject to breathe normally through the mouth with the tongue slightly extended. Using the number 1 nebulizer, inject the aerosol into the hood through the aperture in the hood window by squeezing 10 times, always fully collapsing the nebulizer bulb on each squeeze. Allow the bulb to extend fully between squeezes. Both plugs on the nebulizer must be removed from the openings during use. The nebulizer must be held in an upright position to ensure aerosol generation. Ask the test subject if they can detect the sweet taste of the solution. If they can taste the solution, then note the number of squeezes as 10 and proceed to the fit test. If not tasted, inject an additional 10 squeezes of the aerosol into the hood. Repeat with 10 additional squeezes if necessary. Note whether 20 or 30 squeezes produce a taste response. If 30 squeezes do not produce a taste response, end the test. Another fit test method must be used for that individual. Remove the test hood from the subject. Give the subject a few minutes to clear the taste from their mouth. Rinsing the mouth with water may help clear the taste. You are now ready to conduct the 3M qualitative fit test. Have the subject don and perform the user seal check as instructed in the fitting procedures for the specific respirator. We are using the 3M 1860 Healthcare Particulate Respirator, type N95 for demonstration purposes. You will also use the 3M qualitative fit test as the appropriate fit test method for the 1870 3M Healthcare Particulate Respirator and surgical mask. Instruct the subject to place and position the test hood as before. Then have them breathe normally through the mouth with the tongue slightly extended. Instruct the subject to notify the instructor if the sweet taste is detected at any time. Using nebulizer 2 containing the number 2 fit test solution, inject the fit test aerosol using the same number of squeezes used in the sensitivity test, 10, 20, or 30. To maintain an adequate concentration of aerosol during this test, 1/2 the number of squeezes used in the previous test is injected every 30 seconds thereafter. For instance, if you use 10 squeezes initially, you would follow up with an additional 5 squeezes every 30 seconds after the start of the test. After the initial aerosol is injected, ask the subject to conduct a series of exercises for 60 seconds each. Remember to inject 1/2 the number of original squeezes every 30 seconds through the fit test exercises. First, have them breathe through their mouth normally for 60 seconds. Second, have the subject breathe deeply through their mouth for 60 seconds with the breaths deep and regular. Third, instruct the subject to breathe through their mouth normally and turn their head side to side, pausing momentarily to inhale at each side. Fourth, have the subject breathe through their mouth and nod their head up and down, with about 1 nod per second. Instruct the subject to inhale in the up position when they are looking toward the ceiling. Fifth, ask the subject to read a paragraph aloud and slowly while breathing through their mouth. A reading called the Rainbow Passage is included in the print instructions for the 3M Qualitative Fit Test. Finally, have the subject bend over at the waist, as if he or she were to touch his or her toes for 60 seconds. Conclude by asking the subject to breathe through their mouth normally again for 60 seconds. If the fit test is completed without the subject detecting the sweet taste of the aerosol, an adequate face seal has been demonstrated with that model of respirator. If the subject detects a sweet taste at any time during the fit test, an inadequate fit is indicated. Terminate the testing when this happens. Wait at least 15 minutes if you plan to retest. Rinsing the mouth with water helps to remove any sweet taste. The fit test must be completed before a healthcare worker can be allowed to wear a specific model respirator. A powered air purifying respirator, or PAPR, with a hood may be an alternative for a bearded healthcare worker or those who are otherwise unable to pass the fit test requirements. PAPRs use a blower to force air through air purifying elements into a loose-fitting face piece or hood that covers the entire face and head. A battery and cartridge fit at the waist. PAPRs must be used in connection with an OSHA respiratory protection program that includes procedures for cleaning, disinfecting, inspecting, storing, and maintaining this equipment. Batteries must be stocked and stored. After completing the qualitative fit test, the unused solutions in the nebulizer should be discarded. Immediately rinse the nebulizer with warm water to prevent clogging. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators. The 3M Qualitative Fit Test is one component of an OSHA respiratory protection program. Contact your 3M sales representative or call our 3M Healthcare Customer Helpline for information on N95 respirators, PAPRs, and other elements of a respiratory protection program.